I'm back at Desert Dream Dentistry and Spa, joined with Dr. Marjon Jahromi, and we're going to talk a bit about sedation because she is the anesthesiologist here. How are you?
I'm good, Brian. How are you?
I'm well. Thank you for having me.
Thank you for inviting me.
Of course, in this beautiful space. So, I guess, let me ask you this. How does sleep sedation benefit patients? Is it safe to assume that anybody can just plop in a chair and be sedated?
Well, almost, actually. So we do sedation for a variety of patients. Sometimes they're children who are just uncooperative. So we have kids who come in, they're like 2, 3, 4 years old. They need several crowns. Obviously, they're not going to sit in the chair for a long time. So as long as they're healthy, we can sedate them. In adult patients, we do medically compromised patients who unfortunately are not able to control their body movements and things like that for us to do the dentistry. And then on the other end of the spectrum, for healthy patients, we can do it for any procedure. So teeth whitening, crowns, long treatment plans that would take maybe 4 or 5 visits. We could just do it all in one day, and the recovery's faster. They don't have to take many days off for work. You know, it's more comfortable for them. And actually, it makes it a lot easier for the dentist, Dr. Shah, to actually do the treatment because the patient is relaxed and much more cooperative in that situation.
Makes sense. So tell me this. What are some, as far as an unhealthy patient, what does that look like?
Well, very few people are unhealthy enough that they cannot do anesthesia. So most patients, if they're have a little bit of high blood pressure, high cholesterol, diabetes, all those patients can be managed under anesthesia. It just requires the right technique and the right use of medications and things that we have to eliminate and things that we have to include to make sure that they are safe for the procedure. I've treated thousands of patients, a lot of them who are medically compromised with mild medical systemic conditions such as diabetes and hypertension, and they can safely be treated for 4, 5, even 6 hours. Under the right situations, yeah.
Okay, so for people that are terrified of the dentist, such as myself, if I just wanted to come in and say for like a cavity, could you put me under?
Absolutely, of course. That would be great for us, actually. You would feel like you were asleep for about 5 minutes. It's a short procedure. Depending on how anxious you are, we could keep you on the lower end of anxiety in terms of anesthesia with a conscious sedation. You still wouldn't remember. You might talk to us, but you'd be surprised. You'll wake up and you're not going to remember a single thing. Or we could go a little bit deeper in terms of general anesthesia if you have a little bit more anxiety, and you would be completely unconscious in that situation.
Here's a silly question. Will I be able to go about my day after sedation?
No, definitely not. So basically, we tell patients that they're going to be very tired and lethargic for the next few hours. It really depends, too, on how long your anesthetic was. So if you came in for like that one cavity you were talking about, you could probably feel really good enough to go out maybe that night, but we still tell you to rest and don't exert yourself too much. If we're here for 6, 7, 8 hours, then we would ask you to take a couple days off and just rest and just recover.
And I want to repeat myself, so it's not just reduced to kids. I mean, anybody can come in.
Anybody can come in, yes. I'll do a thorough exam. We'll do a medical, I'll do a history and physical with them either on the phone. If I need to, I will call their physician and get all the extra information, and then I'll tailor the anesthetic for that person's needs.
Got it. Okay, Dr. Jahromi, well, you know where to find her. We're talking Desert Dream Dentistry and Spa here on El Paseo. Come and get a complimentary CT scan valued at $750. And I just learned a CT scan is it's like a high-tech x-ray.
Right, so we can actually, instead of seeing like 2 dimensions in a regular x-ray, we can see the 3rd dimension. So we can tell if the implant, when Dr. Shah places the implant, if it's going to be too deep, if it's going to be close to the nerve. So it actually just increases the safety of the surgical procedure that you're having.
The more you know. Thank you, Doc. I appreciate that. You can find Desert Dream Dentistry and Spa in Palm Desert. Give them a call or go online, desertdreamdentistry.com. Big thanks to the doc for having me. We'll see you in just a moment.